So if you have this condition, come in here and watch this video. This video is actually for you. So most times a lot of people actually head down to pharmacy stores or maybe cosmetic shops or the supermarket to get acne treatment medications when they have this condition. Well, that's a big mistake, because this condition is actually called Milia, and Milia is actually very different from your regular acne. Hey guys, welcome back to my YouTube channel, and as usual, my name is Julie Chisom Eze. I'm a licensed pharmacist, and on today's topic we'll be talking about Milia, causes of Milia, how to prevent Milia, how to actually identify Milia from your regular acne, and also how to prevent Milia. I'll be right back. You'll be wondering, Milia. So Milia can actually be defined as a bump that is visible under the skin, and it arises as a result of keratin that is being trapped under the skin. Yes, that's the easiest way to define Milia. And I know a lot of people wondering, what's keratin? So keratin is that protein that is needed to give your skin the structure it's supposed to have. So how do you identify your Milia from your acne? So like I said, for Milia, they do not have pores compared to acne that have pores. Milia actually, they look like whiteheads, but they are not particularly whiteheads. They are sandy-like, bumpy, and they are bumpy because the keratin is actually trapped under the skin. That's how you actually differentiate Milia. What exactly are the causes of Milia? Like I said, the major reason why Milia occurs is as a result of keratin that is being trapped under the skin. Another reason why Milia occurs can also be genetic. Yes, some people always complain, oh, I've got Milia, even without doing anything. Most times Milia could actually be genetic. When I mean genetic, I mean from one bloodline to the other. 3, Milia can actually be caused from the use of certain medications. Now this is why anytime you walk into the pharmacy and the pharmacist notices that you're abusing your corticosteroids, the pharmacist always try as much as possible to discourage you from abusing your corticosteroids. Yes, you can also get Milia from using your corticosteroids. I know some of you will be like, which one is corticosteroid again? Yes, your corticosteroids are actually seen in your triple action creams. Yes, example, you already know the examples. Example, your Fumbact A, your Olibact, things like that basically. So that's why we always advise that if you're going to be using a triple action cream, it shouldn't be for a long-term use. It should actually be for very short-term use, because it can also cause Milia. Another thing that can cause Milia is your 5-fluorouracil. Your 5-fluorouracil is actually a chemotherapy medication. It can also cause Milia. And another thing that can also cause Milia is slugging. I know some people be like, what is slugging? Yes. So slugging is actually a situation whereby you use petrolatum products, for example your Vaseline petroleum jelly, to actually serve as like a sandwich process when you want to apply some particular skincare products. For example, for people who are actually trying out retinol for the first time, most times they always advise to slug so as to reduce the whole effect of the whole effect that comes from using retinol. Treatment of Milia, I always advise my clients, they shouldn't panic. They should actually be patient, that the Milia would actually go on its own, especially if it's a primary Milia. So a primary Milia is a type of Milia that actually occurs on its own. It just happens on its own. While a secondary Milia is a type of Milia that occurs after a burn or an injury, that's a secondary milia. But for patients or clients who are actually not very patient enough to wait for the milia to go on its own, because most times your milia could actually stay for as long as weeks, for as long as months, and if you feel you're not going to be very patient waiting for your milia to go on its own, here are some treatment options, some list of treatment options that you can use to tackle your milia. Number 1, the use of retinols or retinoids. So retinol is like your go-to agent when you are trying to treat your milia. Retinol or your tretinoin are actually very useful when it comes to the treatment of milia. But for most people, I always let them know, if you're going to be starting your retinol, you can always start out with once weekly, once at night weekly, and then if you use your retinol once only at night for the first week, you can actually do that for 2 weeks, and if you notice that the retinol, your skin is actually adapting so well to the retinol, you can actually now start using your retinol every other night. For tretinoin, I always advise, always start with the lowest concentration, and if possible, I always prefer if tretinoin is actually being recommended or being prescribed by a professional, because that way you're being advised on the things you should actually watch out for when you're using tretinoin. 2, your second treatment option when it comes to tackling milia is using glycolic acid. So for your glycolic acid, do not forget that your glycolic acid is an exfoliating agent. Yes, I know some people will be wondering, why are you treating milia with exfoliating agents? Yes, the main reason why milia actually occurs is because there are dead cells that actually block the pores, which leads to the keratin being trapped under the skin. So that's why exfoliating agents are actually needed or advised, because the more you exfoliate, or if you exfoliate your skin properly, it helps to reduce the buildup of dead skin cells. Yes, so if you're going to be using glycolic acid, you can always go back to my old video where I actually showed how you can effectively use your AHA. Don't forget, glycolic acid is also a type of AHA, which means alpha hydroxy acid. So the alpha hydroxy acid I actually described in my last video is actually mandelic acid. So you can actually try out the same method, but this time around you're using glycolic acid for the treatment of your milia. And please, irrespective of whether using retinol or glycolic acid, do not forget to hydrate your skin and wear sunscreen. That's very, very important. And for your glycolic acid, you're supposed to use that just twice weekly. So pick days and properly space the day method of you treating milia. Now for this method, I'll advise you actually do it with a professional. This is where your dermatologist actually comes in and tries to pick out the whole keratin that is, or the whole bumps that is actually trapped under the skin. They pick it out with the aid of a topical exfoliating agent. Please do not do this at home. Meet a professional to do this. Here are some tips that will actually help you prevent milia. Number 1, change your skincare routine. Yes, I know some people will be like, why do I have to change my skincare routine? A lot of people always have this feeling or have this sense that if it's not a 15-step skincare routine.
All I hear now that I've decided to always reapply my sunscreen.
You need moisturizers that have on their labels oil-free and non-comedogenic. These moisturizers are actually light and also help to ensure that you don't have anything trapped under your skin or you don't have any blocked pores and all of that. Number 2, if you have to slog, please slog, but do not over slog. Yes, I know a lot of people like, what do you mean by overslug? Don't forget that slugging also causes milia because it involves the use of petroleum jellies, and petroleum jellies are actually quite thick. So if you're going to be slugging, I'll advise you reduce the number of days you actually slug. Maybe instead of doing slugging for a particular day, you could actually just do the sandwich method that involves using more hydrators instead of thick moisturizers. Number 3, exfoliate your skin using very good chemical exfoliants. And don't forget, if you have to exfoliate your skin, you need to exfoliate your skin at least twice weekly, or at most thrice weekly. Do not over exfoliate. Over exfoliation could actually lead to more breakouts. So imagine trying to tackle one issue and then you have another issue coming up. Number 3, reduce the way you use your corticosteroids. Corticosteroids, like I mentioned, should be agents that are used for just a short period of time. You don't have to use your corticosteroids for a long period of time. Well, I hope with these few tips we'll be preventing our
really? Well, I'm saying that my cream finished about 4 days ago.
But you still fine for my eye.
Yeah, it's an imported cream. It works like that. I'm happy. I'm not surprised, Yes.
So thank you so much for liking, sharing and commenting. And in case you have anything to add to the topic I just talked about, you can always drop your comments in the comment section, and as usual I will always attend to your content. And as usual, thank you so much. My name is Pharmacist Julie Chisom Eze. Until I have another video, or until I drop another video, thank you. Bye.